Hi everyone, Assalamualaikum. So today we are going to learn about motor tics. So let's get started. Now let's get started with the definition of tic disorder first. So tic disorder are the neurodevelopmental condition that categorized by the presence of involuntary, sudden, and repetitive movement or sounds. So there are several types of tics, which include Tourette syndrome, motor tic, vocal tic, chronic or vocal tic disorder, provisional tic disorder, transient tic disorder, and other tic disorder. So understanding the different type of tic and tic disorder is crucial for accurate diagnosis and appropriate management. But today we are going to learn one type of tic disorder, which are motor tic disorder. So what is motor tic? Motor tics are a sudden, rapid, and repetitive movement or gesture that are involuntary and often difficult to control. So these usually begin in the childhood and can be very in frequency and their severity. So they tend to be more prominent during period of stress or excitement, but may decrease or disappear during the periods of concentration and or absorption in activity. So the exact cause of tic disorder is not fully understood, but there are evidence to suggest a combination of genetic and environmental factors may contribute to their development. So tic are often manageable and some individuals may outgrow them over time. So in some cases where tics significantly interfere with the daily functioning, or if they are causing distress, medical or behavioral intervention may be considered. So motor tic can be categorized into two types, which are simple motor tics and complex motor tics. So simple motor tics is a brief, sudden, and repetitive movement that involve a limited number of muscle groups, such as eye blinking, head jerking, shoulder shivering, facial grimacing, and nose twitching. But for complex motor tics, it's more like involve the multiple muscle group, such as touching object in a specific way, hopping, performing a specific sequence of movement, and obscene or inappropriate gesture. So here is the symptoms of motor tic that involve eye blinking, head jerking, shoulder shivering, facial grimacing, nose twitching, mouth movement, neck twisting, arm movement, hand or finger movement, leg movement, toe curling, and lastly complex movements. So it is important to note that the severity and types of motor tic can be vary widely among individuals. So tics often have a waxing and waning course, meaning that their intensity may increase or decrease over time. So stress, excitement, and other factors can influence the frequency and severity of motor tics. Motor tic often begin in childhood, usually between the age of 5 and 10. The peak onset of tic disorder, including the Tourette syndrome, often occur around that age, although tic can emerge at any age. While the less common motor tic can also onset in adolescence and adulthood. So to add, tic, especially more severe form like Tourette syndrome, are more common diagnosed in male more than female. But female also can have tic disorder, but they may be underdiagnosed as their symptom might be less severe and more easily masked. Plus, tics are sometimes associated with other neurobehavioral conditions such as ADHD or OCD. So, some individuals with tics disorder may also have learning or behavioral disorder. So there are several factors that can trigger tics. The first one is stress. So many individuals with tic disorder find that tics become more pronounced during period of increased stress or anxiety. So stress is often identified as a triggering factor for the onset of tic, and tic may also be more prominent during emotionally intense situations, whether positive or negative. There are also some of environmental triggers that include sensory input, routine changes, social situation, and school or work stressor. So, for sensory input, certain sensory stimuli such as a specific sound, light, or texture can act as a trigger to tics. All right, so for routine changes, so the changes routine or exposure to new environment may contribute to increased stress and consequently an increase in peak frequency. All right, next, the social interaction, particularly those involving high expectation or performing anxiety, can be stressful and may influence tics expression. All right. Lastly, academic or occupational stressor can impact tics. So individual might find that tics are more pronounced during challenging tasks or deadlines. So these are some of the condition that can trigger tics. So we need to understand the relationship between tic and stress is essential for developing effective coping strategies. All right, now we are going to explore the impact of motor tic on daily life by understanding how this involuntary movement can influence various aspects of individual routine. So, as we delve into social interaction, it is important to note that motor tics can present social challenges, contribute to self consciousness, and potential misunderstanding among peers. So, moving on to educational and occupation setting, so we'll discuss how motor tic may interrupt or disrupt classroom activity, affect attention, and influence workplace performance. And lastly, how emotional aspect, examining how motor-tic can impact the self-esteem, contributing to emotional distress, anxiety, or depression in some cases. So, individual with motor-tic often develop coping strategy to manage the impact of the tic on their daily life. So including finding way to minimize the stressor or using technique to temporarily suppress their tics. So some individual can suppress their motor tic temporarily, especially during activity that demand focus. So here are some of the personal coping strategy that we can suggest, which include open communication, advocacy, professional support, and variability. So it is important to know their own coping strategy to cope with the disorder to less the impact on the daily life functioning. So the management of motor tics seen in conditions like Tourette syndrome involve a tailored approach that combines behavior intervention, psychoeducation, and support environment. So let's see one by one. So for behavioral therapies like habit reversal training (HRT) and comprehensive behavior intervention for tics (CBIT) is aimed to increase awareness and provide coping mechanism. So next is psychoeducation. So this psychoeducation actually help individual and their family to understand the trigger and stress management. Lastly, creating supportive environment at home and in educational setting along with considering medication when necessary, contribute to effective management. So please regular monitoring and collaborative multidisciplinary approach with healthcare professionals to ensure the support and adjustment as needed for individual with motor tics. So, in conclusion, orthotics can have multi-phase impact on daily life. So, from social interaction and educational setting to emotional well-being and family dynamic, the challenges posed by motor tic are diverse and individualized. So, however, with increased awareness, understanding, support, individual with motor tics can develop effective coping mechanism and lead fulfilling life. So, recognizing the importance of a comprehensive multidisciplinary approach involving behavioral intervention, supportive environment, and when necessary medication is crucial. By fostering a compassionate and informed community, we can work toward minimizing the impact of motor tic and enhancing the overall well-being of those affected. And with that, I think that's all from me. So thank you for listening and see you around next time. Bye bye.